What does eat mean in this? Can someone help me out? Do not delegate what you can eat. In terms of delegation, which one can you not delegate to your CNA or your UAP? Okay, what is eat? If it requires you to have an evaluation, if it requires evaluation, you do not delegate this. And this is a good tip for NCLEX prep. Okay, if it requires assessment on your part, okay, you do not delegate this to your CNA or your UAPs. If it requires treatment, or teaching, okay, that means, and if you follow this rule, you'll be okay on my delegation. I mean, even NCLEX questions in terms of delegation, if you follow this principle, do not delegate what you can eat. Okay, so ask yourself before you pass this on to your CNA: does this task require evaluation? Does this task require assessment? Okay, does this task require treatment or teaching? Then you do it, and you're not going to delegate that to your CNAs. All right. So in terms of delegation, the skilled task of bathing often is delegated. Typically, we delegate this to our CNAs, right? Now, skin and range of motion exercises, okay, or assessment require the critical thinking and knowledge of someone who is licensed. In this case, when you become licensed as nurses, okay, this requires your skill, okay? So if it doesn't, the routine bathing, that can easily be delegated to your CNAs, okay? So based on the order of the doctor, again, give the proper instruction or communication to your CNAs. What type of bath should be performed? Is it partial? Does the patient require partial assist, full assist? Okay. Is it a full bed bath, or can the patient use the shower, or is the patient allowed to use the hot tub? Okay. Remind the UAP to notify you of any skin integrity problems. Okay. And this is why I always tell you, when you work in the actual setting, one of the people that you need to have a good relationship would be your CNA. Okay. Because no matter what, they can make your life miserable. Okay. If you don't treat them well, they can make your life miserable. Okay. So having a good relationship with your CNA makes it everything work nice and easy for both of you. Okay. So always maintain that good relationship. Remind the UAP to use an organized approach and reassuring tone of voice so that the patient feels safe and comfortable during the bathing process. Okay. So these are all the things I need. Communication is important. Now, in terms of a gag reflex, oral care, okay, if you need to assess the gag reflex of the patient, can you ask the CNA to perform this? Can you delegate this skill to your CNA? Can you tell your CNA, oh yeah, can you assess if the patient has if the gag reflex has returned in that patient, please?
No, you cannot tell them that because you just said, can you assess? And you said you cannot delegate if it asks for an assessment.
Right. Okay. Anything that involves evaluation, assessment, treatment, or teaching should not be delegated to the CNA. Okay. So meaning before you give this task to the CNA, yes, you can. The CNA can still perform the oral care, but you do this part. Okay. It is your responsibility as a licensed nurse to assess for the